Hey guys, today I'm going to be speaking about the USMLE Step 3 CCS mnemonic. And this is basically CCS, so computer-based case simulations. And this is really your altered mnemonic. If you know this mnemonic, you're good, okay? And you're really going to get like, I would say like 90% of cases you're going to get correct with this mnemonic. And this mnemonic, the good thing is it applies to everything. And in my next video, which I'm going to make, it's subject specific. So it's specific to the cardiac system, endocrine system, GI system, musculoskeletal, hematology, oncology system, renal system, psychiatry, reproductive, pulmonary system. It's specific to the systems. But this specific mnemonic, it's going to apply to all of your patients, and you're guaranteed to get like at least 80 to 90% marks. Correct. I can guarantee. You guys don't need to like take photos, screenshots. I'm gonna make all the links on my website. I'm gonna mention my website. I don't completely free. I'm not charging anything. It's completely free, and you can take the mnemonic and you can copy paste it and you can share it whenever you want. Okay. Okay, so first of all over here is me car fuel. Now, car fuel, let's look at the mnemonic first of all. Car fuel, TT, BBB, and U, cubes, T maple. Now, when you look at this mnemonic over here, like a car fuel, all this stuff, like car fuel, how you remember that? Car, like I remember, like you come to the hospital in a car, okay? Fuel, I remember that kind of like fluids. You need nearly every patient gets fluids. TBBB, it reminds you of tuberculosis. That's very common in the hospital. And U is kind of something I'm memorizing, and cube stimulator I'm also kind of memorizing, but it kind of gives me an idea of all the tests. Okay, car. Car, the C over here is going to be cardiac monitor. A is going to be ABG. R is going to be random blood glucose. F is going to be fluids. I is going to be IV access. O is going to be oximeter. The F over here, the T over here is going to be TIBC transfers. So you can transfer, for example, to the ICU. You can transfer to your to the floor. It's up to you. And then bleeding time, blood type and screen. And we also have another one, bleeding time, blood type and screen, and yes, we're going to have also blood pressure because you're going to come across a lot of cases with orthostatic hypertension. So you want to look at posterior blood pressure. You can just order that just to make sure. NG tube and ultrasound over here is going to be also really important over here. Okay, perfect. Then we're gonna come over here to the cube steamable. So C over here stands for five. That's why I wrote here C5 because it's five tests. U4 because four tests. B6 because B has six tests. E has three tests. S is one test. T has two tests. M has one test. So I didn't write anything. And then we have over here the P is gonna be three tests and L is gonna be four tests. All right. So CBB, CC, what's going to be here? So C, what's our five C tests? CBC, CMP, CPK, CRP, and chest X-ray. Of course, you can go to CD scan, other stuff. That's up to you depending on the case specific. U is going to be urinalysis. U is going to be urine toxicology. U is going to be urine culture. U is going to be urine Gramsing. B is going to be hemoglobin A1C. B is going to be beta HCG. B is going to be haptoglobin. B is going to be blood culture. B is going to be blood toxicology. And the other B is going to be your BNP for heart failure. E is going to be ESR, E is going to be ECG, E is going to be echo. S is going to be your stool study. So you can do stool PCR, stool culture, stool Gramsci, whatever you want to do. Then over here, the T is going to be TSH, the T is going to be troponins. M is going to be magnesium, P is going to be phosphate, prothrombin, PTH, and L is going to be lipids, LDH, lactate, and LFTs. I want to just come over here into the next one over here. What is nasogastric tube? What are its uses? So nasogastric tube is inserted to the nose into the stomach to provide nutrition, medication, and remove gastric contents, decompression. It is used when a patient cannot swallow safely, stroke, neurological disorders, or when the stomach needs to be empty due to bowel obstruction, vomiting, or post-surgery. Common conditions of nasogastric tube include strokes, dementia, Parkinson's, head and neck cancers, causes swallowing issues. Small bowel obstruction, severe burns and trauma, and premature infants need supporting feed. So that's going to be here. In my next video, I'm going to speak about subject specific, but this one I just want to recap for you. CAR, FEU, TT, BBB, NU, cubes, cubes, T maple. Let me do the mnemonic. Cardiac fluids, ABG, random blood glucose, fluids, IV access, oximeter, transfer, TIBC, blood pressure, blood time, blood type and screen, bleeding time, blood type and screen, nasogastric tube, ultrasound. Cube simulator, CBC, CPK, CBC, CPK, CBC, CMP, CPK, CRP, chest X-ray. You can of course do CT scan, urinalysis, urine toxicology, urine Gamson, and urine urine culture. Then B is going to be beta HCG, B is going to be BNP, B is going to be blood toxicology, B is going to be blood screen, blood culture, of course, and then we get haptoglobin, hemoglobin, A1C, ECO, ESR, and ECG, stool studies, TSH, troponin, protonin, phosphate, and PTH, and LDH, LFTs, lipid, and lactate is going to be seen over here. That's the mnemonic. Hopefully you find this video useful. Thank you for, please do subscribe. Please do share this video. Please do like this video. I spent a lot of time making this video, and please do check out my stuff in the description. It's also gonna be free. And please check my next video, which is also gonna be very useful for you guys. Thanks for watching. Hope to see you guys next time.